Okay, so you feel perfectly fine, right? But did you know that you can still be at high risk for a heart attack, a stroke, or even kidney failure? That's because that's the reality of high blood pressure, also known as the silent killer. I talk about it a lot, but I just want to bring this up again because so many people are at risk and they don't even know it. There's no symptoms, no warning signs, just damage is happening inside your body. And it affects over 100 million people in the US, yet no one seems to really be focused on it until it's too late. And the reason I think this happens is because our healthcare system, we are a reactive healthcare system and not proactive. And so, especially if you're young or you've never had to deal with high blood pressure before, you go into the provider's office and they say your blood pressure is good or they're not concerned about it. Therefore, why are you? But the reality of it is, what is good? Do you ask the questions? Do you only seem to notice when it's bad? Or, sorry, I digress. Do you have family members with high blood pressure? These could put you at a higher risk. The bigger point here is prevention is power. And so, doing small things now, especially while your blood pressure potentially is still good, can really prevent you from suffering from potential heart attack, stroke down the road. Don't wait until it's too late. So some things that you could do now. Start exercising if you're not already. Taking walks. I recommend doing 15 minutes in the morning and in the evening. That's 30 minutes a day if you can do that. I'm sure your dog would appreciate it, or even your kids or your grandbabies, whoever it is. But your body's definitely going to thank you. You only get one body, and the earlier you start taking care of it, the better chances you are of. You only get one body, and the earlier you start to take care of it, the better your chances are of avoiding serious complications later on. So between the food we eat, between the way we take care of ourselves. So let's decode the numbers just a little bit. For most people, normal blood pressure is considered less than 120 over 80. If it's above 120, that's considered elevated. 130 to 139 over 80 to 89, that's stage 1 hypertension, and above 140, that's stage 2. Now, your provider is going to have specific numbers for you, okay? Maybe they're going to tell you 130 and above is fine for you. Maybe they want you at the 120 mark. But these are conversations that you need to know because you need to know where your goal line is, right? But even slightly elevated blood pressure over time will start to cause damage. So again, you want to know. One way that you can check your blood pressure if you're not going to the provider's office very often, grocery stores like Publix, right? They have blood pressure cuffs. And you can go in there, and I'm pretty sure they're free. Just go in there, put your arm in, and get your blood pressure taken. You go to the grocery store, once a month? Go check it then. Or you can buy a blood pressure cuff off of Amazon. Just don't do the wrists if you can avoid it. I'd get the arm cuff and check it as often as you can. That's my little tidbit there. I really recommend people check their blood pressure as often as you can and kind of know what your benchmarks are so that you know if you are on track. If you're not, do you need to worry? Are you fine? Also, there's a time and place for medications. I'm a pharmacist. I've seen medications work for people, but here's what most people are not being told. Blood pressure medicines can actually deplete essential nutrients. I've seen too many times patients coming off of their medications because it doesn't make them feel good. And although it's treating their numbers, although their blood pressure levels are within check, they feel like crap. They are tired. But that's actually the biggest one I hear is I am so tired all the time. And that's because the essential nutrients that are being depleted, magnesium, potassium, zinc, vitamin D3, these are critical nutrients that your body needs, not just to feel better, but also it helps with your cardiovascular system. And so if these are draining you, these could be affecting overall how you feel. So the question now, what do I do? Well, you want to replenish those nutrients, and sometimes food is not enough. If you are eating an okay diet and taking medications, chances are you are definitely not getting all the nutrients that you need. So supplementation matters, and good supplements that are going to be put back into therapeutic doses. Not to toot my own horn, but the one that I made that really targets in on what's being depleted and tries to put that back in therapeutic amounts. Sometimes you can do these things alone with diet, but sometimes you need a little extra support, and there's nothing wrong with that. So my point is to really fill in those nutrient gaps. And I could do another video that dives a little bit more into nutrient depletion, but here's the truth. Many of us are taught that we need to just wait around until there is a problem. But with blood pressure, waiting is the problem. Just because your numbers have always been fine doesn't mean that you're in the clear. Prevention is everything. And take this from someone who's been there. I have a really bad habit. I think most healthcare providers have a really bad habit of thinking that we're fine too. So you're not alone here. I can't tell you how many. Okay, I can tell you guys about when I was pregnant. I was in my 9th month of being pregnant, and I had, I think, gone to the doctor 3 different times for false labor, Braxton Hicks. And the last night, the day it happened where I was actually about to give birth, I thought it was Braxton Hicks again. So I had my husband, we walked around the block. I think we walked like probably about half a mile to a mile, because I was trying to just even out the Braxton Hicks thing. We're not going away. And my husband's like, I really think we should just go to the hospital. And I was like, nope. I don't think this is real. And I don't want to be embarrassed because, going to the hospital as a pregnant lady is so embarrassing. I don't know what I was thinking, but I thought I was fine. And I ended up collapsing on the sidewalk. And when I got to the hospital, it was actually too late for me to get the epidural. And the baby came out within 20 minutes of me arriving at the hospital. It was all natural, super traumatizing, by the way, because I had a whole birth plan and obviously nothing went according to that birth plan. So that was fun. Anyways, long story short, don't wait for something to happen. Be proactive now. I don't know if that was the best story, but now you know how my crazy brain thinks. Yeah. Be proactive. Start eating better now. Start taking care of your body. You only get one. Take care of it now and do what you can. I'm here for you. I'm rooting for you. I'm rooting for myself too. I'm sure you guys are rooting for me. Like, let's just be a healthier, happier society. And all the processed foods that are out there, all of the extra ingredients that are making us fat and making us sick, do the little bit you can to mitigate that. Use less salt. Try and use more fresh herbs if you can. For those of you who enjoy cooking, this is a good opportunity to actually make dishes. So I hope that this was helpful. Just to sum it all up, high blood pressure affects a lot of people, and a lot of people don't even know that they are affected. So my big takeaway here is find out where your baseline is. Find out what your blood pressure is looking like. And if it's good, great. Keep up the good work to keep it staying good. If it's not looking good, okay, what changes can you make now so that this does not get worse down the line? All right, guys, that is it. My name is Kiara Emery, and I hope that this was helpful for you.